The title of this webinar is No Right Way and No Wrong Way to Grieve, Dealing with Grief in the Private Practice by Stephen Riley. The following will tell you about dealing with grief in a private practice, especially in a rural community. The purpose of this webinar is to examine the ways by which private practitioners can utilize various techniques to accommodate clients experiencing grief, but most essentially those suffering from complicated grief. Below are some of the definitions of normal grief, which is common to most life experiences when one suffers a loss, versus complicated grief, sometimes called prolonged grief disorder or avoidance grief, which can be described as debilitating clinical conditions which would exist if it causes significant impairment of functioning for a prolonged period of time. Normal grief is common life experience, and people will sometimes seek counseling in order to cope with their loss. However, current research has shown that grief interventions for those experiencing normal grief tend to be minimal, if at all, effective. However, there is efficacy of interventions that are targeted to grievers with higher levels of distress, basically those with clinical symptomatology. Studies have demonstrated positive and lasting effects for specific grief therapies for bereaved people who meet the criteria for prolonged grief disorder. Basically, these are the type of people that your counseling would come in very handy for. There are problems associated with attempting grief counseling in private practice. Probably one of the largest problems is the fact that most counselors are not educated in how to do grief counseling. They do not take courses in grief counseling. As a matter of fact, 83% of counselors have not had courses in grief counseling. However, people, especially in rural practices, are familiar with other types of counseling, CBT or REBT, whatever your form of counseling is, and they try to apply that to grief, and it may have certain effectiveness. You just have to try to apply it right. Location in metropolitan areas has a benefit in that oftentimes there may be a specialist for grief counselors. However, in the rural area, this is not the case, and therefore people have to have an incentive for trying to include education in their graduate programs, or at least taking seminars so that they can be aware of how to deal with grief. Dealing with grief is a little different than dealing with depression and some of the other psychological problems that people can have. One of the other influences is cultural influences can affect grief, and the counselor should be familiar with how various cultures handle grief and whether certain interventions must be employed to either strengthen or lessen the effect of that culture that it has on grief. For example, the old English stiff upper lip approach, get over it and carry on, my good man, is not appropriate really for handling grief. It might be for some people, but basically people have to deal with grief in their own time, in their own space, and with a little bit of help at times. Just telling them to have a stiff upper lip and get over it doesn't really work to help them recover from grief effectively. Other factors that can affect grief counseling would be age and mental ability. The age of the person experiencing grief can be a factor on how one approaches their counseling situation. Obviously, when you counsel a child, it's different than counseling an adult or an adolescent. And of course, counseling adolescents is different than counseling an adult usually. However, the mental capability of the person also matters. You have to be aware that could be dealing with different IQ levels, different stages of development, or even you might have to be dealing with a person with dementia, as usually is in the case with an older couple where one has died and one is still alive. If they're in their 80s or so, you might be dealing with somebody with dementia. Education level is another effect on the ability to successfully carry through with grief counseling. Certain studies have shown that a person with lower education levels has a worse outcome after treatment than those with higher levels. And that doesn't mean that they are worse, it just means that their level after treatment hasn't reached the same state as somebody with a higher education. Usually people with higher educations have a better outcome after treatment than people with lower education. But it still has an effect with both people. That's usually helpful. Levels of the relationship of the deceased is another one. If you've lost a domestic partner or a child or somebody who was killed in an accident or died suddenly, your outcome again is not as great as those who did not have that type of a loss. However, you still do have a certain amount where you have gained some counseling experiences from having grief counseling, even if you've had those situations. And motivation is certainly another one. Studies have shown that motivation is worse for people who discontinue treatment. If you don't have proper motivation, then the people will drop out of counseling. Better outcomes are associated with higher therapist-rated motivation, so therefore people should really know how to do motivational counseling, how to be empathetic, and how to relate to the person that they're counseling. There are various interventions that a counselor can use Cognitive behavioral therapy, CBT, is one of the better ones that has been shown at least to be evidence-based. And basically what they work on with the CBT is cognitive restructuring. And in these sessions they focus on psychoeducation to explain homework, to identify and challenge negative cognitions, recognize dysfunctional cognitions associated with loss, recognize catastrophic misinterpretations of grief reactions, and learn to dispute and alter negative cognitions such as hopelessness, worthlessness, and meaninglessness. It's kind of like bringing out the old cognitive triangle and going through feelings, thoughts, and behaviors. Exposure therapy is the other part of this, where you gradually expose the client to the reminders of the loss as a means to facilitate confrontation and elaboration. Researchers have clients do narrations of loss, examine photos of loved ones, and other such activities that help the person be exposed to loss, identify with their internal thoughts, and eventually affect their behaviors so they can handle the loss better. The results of the study with cognitive behavioral therapy are there are the demographic variables, of course, which we've discussed, such as the levels of education, relationship with the deceased, failure to complete treatment, and other such demographic variables that could affect how well somebody performs with counseling. But improvements with the participants were significant in a number of areas. First of all was there was a greater symptom reduction for complicated grief associated with reductions in negative cognitions about self and catastrophic misinterpretations. And secondly, there was a greater reduction in the situational avoidance, avoiding places that remind a person of the deceased, ruminative avoidance, thinking repeatedly about the deceased, and thought suppression, trying to keep thoughts about the loss out of mind, and distraction, doing type of behaviors that distract you from thinking about the loss of somebody, going to work and just doing work continually so that you don't have to think about the death. So therefore there were some reductions in these type of activities due to cognitive behavioral therapy. However, you can go beyond CBT. This is why the individual counselor has to be creative and has to understand the individual that they're counseling with and their individual needs. Basically, the private practitioner must realize that each person suffers from grief in their own individual manner, in their own time, in their own space. Various models of grief therapy, such as Kubler-Ross's, which gives stages of grief therapy that one must go through, are not really in vogue today. Many of these stages, there may be no pace to it, no particular serial order, maybe no end to it. Actually, most people, when you think about it, there is no end to grief. There's just a reordering of it. In other words, you'll always have the grief or the memories of that person with you, but it's how you handle that in the future. Therefore, even though different authors provide different stages than others, the individual counselor must be able to modify his approach depending on the individual's needs and symptoms of their client that they're conducting counseling with. And you have to be very empathetic to them and be able to come across neutrally so that you can basically help them with their grief. There are various forms of counseling and interventions that can be used to counsel a client with grief or complicated grief. Some may not be as evidence-based as others, but there is research going on in the field at this time on a number of these theories. As in many cases, the results of counseling depends on the counselor's philosophy, their training, their experience, and how they come across people, how they can motivate a person, and how they can keep them in counseling. Basically, mindfulness is one of those. It's often associated with DBT, dialectic behavioral therapy, which is often used for personality disorders, but also being used for depression and grief and other types of counseling. I would recommend going to YouTube and watching Dr. Jon Kabat-Zinn as he describes mindfulness and a way to live your life through how it really matters. It's kind of being in the present and with kindness to yourself. It's a matter of deep breathing. It's a matter of almost Zen type Buddhism in some ways, where you learn to appreciate yourself and you can be calm and collected about situations that handle about you and be in the present. Psychodynamic theory, this is kind of more of a Freudian type of theory, or a psychotherapy you might say, in which we look at how people internalize and experience their relationships and the loss of their relationships. Basically, this form emphasizes the unconsciousness, the unconscious workings of the mind. Modern theorists recognize that grief is highly individual and has no clear finish line. Therefore, some theorize that a combination of this type of theory and CBT can be very effective because you're working not only with the unconscious, but you're also working with behavior and how to handle that. It might be very effective to understand both types. One of the interesting theories I came across was that using therapy animals. Actually, therapy animals are sometimes used in funeral homes to help people who are there grieving during a funeral. and counselors use them, especially with children, because children can really relate to therapy animals, especially dogs. Dogs have a certain way of communicating with people and vice versa that kind of lets you emote to them, and they seem to emote back to you, whether they are or not, who knows. But basically people can relate, and especially children can relate to dogs very well and let their emotions, their feelings out. They can be other animals such as parrots, horses, whatever kind of animal can help people get through their grief. Basically, the article I read talked about horses being used as a therapy animal. The author talks about putting the pieces together and how the use of horses helps people get through their grieving process. She talks about how the grief process involves taking the pieces of who the person was prior to the death, incorporating that into the person they have become. She feels that the horses have the ability to perceive a person's inner emotions, thoughts, and energies, and provide a safe place for clients to acknowledge, express, and work with their grief. I've had horses all my life. Personally, I feel that horses are a great animal. They can really feel your emotions and your energy and how they react to you. If they can understand your thoughts, I really doubt that. They're not the smartest animal in the world, but they do relate very much to how a person reacts to them. And this also allows the client to grieve in the manner they need to through the horse, rather than in a manner that society or the client's friends and families deem appropriate. Basically, hopefully the horses are well trained, because they can also kick you if you don't treat them right. However, people who ride horses do get an immense amount of relief from riding horses, and it might just be the mere physical fact of being on the horse, the movement, the seeming communication that you might have with the horse as far as getting it to do what you want it to do, that might be helpful in this situation. A possible intervention that I would like to try sometime, I would prefer to try doing grief counseling in a group type of setting, and for that I'd try using emphasized psychodrama. Basically, I feel this could be interesting in that it would allow the people in the group to basically free themselves from old feelings. They could explore spontaneity, creativity, fantasy, and do role-playing within the group. It would allow them to live out an alternative way of coping with their concerns, while also allowing feedback from the other group members and role-playing by various members. Now, you'd have to be very careful and explain to people basically the protocols of group counseling, and mainly the confidentiality that goes along with it. But I feel it'd be a really nice way to have people be able to express themselves, be able to go through their grief, be able to show their grief with different situations, and have a community of people around them be able to share that with them, put in their ideas about it, and maybe play act how they would handle the situation. I think that this could be combined with CBT, so that you could also develop in vitro type of activities for them to take, or homework type of activities for them to do, to work on the aspects that they learned while confronting their grief in the group type of scenario, and with the acting out. It might help them be able to go through cemeteries or look at pictures that they hadn't been able to do before. This paper also is made, or this webinar is made for a small rural area in New York State, basically Cattaraugus County, and the community resources that are available there are not numerous. However, I've listed some of them here for those people from that area that they could contact if they're having problems with grief or need counseling. That would be Community Services, Foundations for Change, CARES, Hillside Children's Center, and Dr. Craig Zuckerman. There are also various online sources that I went to in order to create this webinar. The Doogie Center, the National Center for Grieving Children and Families, was very helpful. They had many serious podcasts, namely the ones I looked at, Who Am I Now, and The Myth of the Grief Timeline, were very interesting. But they have numerous other ones that you would find very helpful in any grief counseling that you would want to do. The Center for Complicated Grief provides YouTube videos on the subject. There's many different types of people who make the videos for them. One of my favorites is Dr. M. Catherine Shearer of Columbia University. She's one of the heads of the Center for Complicated Grief, and really gives some fine lectures on how to deal with grief and how they would deal with grief. Dr. Jeff Warburton gave a TED Talk called The Adventures of Grief, which is very interesting. That's also on YouTube. Dr. Sylvia Gearing talked about mindfulness for grief and anxiety, part of a series of psych videos they're called, that are on YouTube. And John Kabat-Zinn, Life is Right Now, Mindfulness Training Online, or for that matter, any of the videos that he does, which talks about mindfulness and meditation. He's very good with this, and it's well worth watching. And finally, the references that I used for making this webinar are included herein. Many of them are far more explicit in how they described various types of grief counseling and how to use them. And I would recommend going to any of these references. They're really in depth. They gave some very good material.